The first experience I remember, there was a module by Mayur sir, and he just told that how you can use the surahi to store it at a lower temperature. We don't really need a fridge, and that for me was like, wow, there is so many patients. I didn't know this. So many patients who I could actually go back and tell that in the OPD. Okay, now your HbA1c is this high, so you should maybe switch to insulin. This is how you can store it, and this is how I can teach you how to give it to self-administer it. So that for me was a big thing that day. So for me, CPCDM was more for my personal growth and to make me more confident as a clinician. Hi, I'm Dr. Lawaa. I'm a final year medicine resident from KMC Manipal. I belong to a non-medical family, and the basic reason that I became a doctor was for the feel of it. And you don't really feel like a doctor until you treat diabetes. So I was interested in diabetes and, in fact, diabetes and hypertension during my internship. And my main thing was that by the end of internship, at least I should know to treat diabetes. During the second wave of COVID, one of my uncles felt really sick, and I had to micromanage things and monitor things. And that's when I learned it's not just me learning to manage diabetes, it's also how I put it across to people and how I tell them how to manage diabetes. During PG, especially in medicine, day in, day out is diabetes. Every day in OPD, when patients would come to me with the HbA1c of this, let's say 11 or 12, or maybe they are just obese, and so I would prescribe. I was able to do it, but I wasn't very confident on what exactly I'm doing, and it's very hard to go back and find the correct thing, or always have someone around to. We don't really have someone every day around to ask the smallest of the doubts. And then when I did hear about the CPCDM course, I thought it would be a nice idea to join it, so it helps me in my day-to-day practice. So what I did was, whenever I had a patient, I would go back and use that particular module. So that's where it came in handy, and I didn't have to go it from the start to the end. I could just use that patient as my case and go back to the module, read about it, and see just that then and there. And another best part was I could do it while I was cooking or while I was having food, because during residency we don't really have that much time to spend on extra things. And then I could sit and jot down the main points on a later date, or maybe in a day or two, or whenever I was in the ward managing the patient. Honestly, residency is hard. It's not easy, and there are very few things that keep you sane during those 3 years. And being able to prescribe the right treatment to the patients, and them coming back and maybe sometimes finding the blue-haired doctor to thank them, I think that's what keeps me sane. And I think CPCDM would have helped me in there to give the right treatment to my patient.